Hi, I'm Cindy Perlin from the Alternative Pain Treatment Directory, and I'm here with Dr. Estelle Farrell. She's an integrative pain management specialist, and we're going to be talking to her about what is integrative pain management. She is board certified in physical medicine and rehabilitation and pain medicine, and her practices are located in Scottsdale, Arizona and Sedona, Arizona, and she's been in practice for more than 20 years. So thank you for joining us, Dr. Farrell.
It's wonderful to be here.
So let's start off by talking about what is integrative pain management.
Integrative pain management is dealing with a person on mind, body, and soul, as well as how they interact in society and how they actually view themselves, where they are and where they're going.
And how does that help with pain?
Well, if you feel better about your situation, you're probably in a little bit less pain. It's also important to know what's wrong with you. If you know what's wrong with you and the problems that you're dealing with, a lot of times it's easier to deal with the pain then too, rather than just taking a medication, rather than just taking something or getting something done to you. It's actually really nice to be part of your healing process on yourself as well.
So integrative pain management gets more to the root of things. It doesn't just cover it up.
Correct. It doesn't cover it up, and it actually involves the patient as part of the healing process. So when you're involved in your care and you understand what's happening and you understand what you're doing to make yourself better, it really makes a huge difference.
So what are some of the tools that you would use in your practice, both to figure out what the problem is and then to treat it?
As a physical medicine rehabilitation specialist, I do a lot of orthopedics and neurology. And so I do electrodiagnostic testing, we do lab testing, we do physical therapy testing. We actually do physical therapy, and part of the electrodiagnostic testing tells me if we're dealing with a problem with the spine, a problem with somewhere else in the body, or a metabolic issue. So sometimes we're going to be running labs and all different types of labs depending on the type of problem there is. And we also do imaging. We like to look at ultrasounds. We like to look at MRIs, x-rays, all different types of treatments.
So when I think of integrative pain management, I don't think of it as something that brings in so many, lab tests and technical tools. Is that unusual in your field as an integrative doctor?
Actually, it's not so unusual anymore. It used to be cutting edge. About 10 years ago, I was considered a little bit cutting edge because I was putting the integrative medicine as well as the traditional medicine together, and it was cutting edge. Now it's actually coming more mainstream. I've been teaching this for many years, and now it's becoming more common and actually used quite often.
So once you figured out what kind of problem it is, what kind of tools do you use? What kind of treatments?
We use quite a few tools. Now, when you talk about regenerative medicine, it's not only taking your blood or taking, someone else's donor tissues and using that in regenerative medicine. My view of regenerative medicine is also things that enrich your life and make you feel regenerated. So it may be vitamin supplementation. It may be a different type of approach that you need to take that makes you feel more regenerated and vital. So it may be psychological care. It may be a physical therapy modality, or even light therapy. It can, or acupuncture, or any of those things. Those still fall into the realm of regenerative medicine. And so I do those types of things. We do physical therapy. We do, I'm an osteopath, so I do osteopathic manipulation. I do a lot of different modalities, and I really tailor it to the patient and what their issues are.
So do you do all that yourself, or are you a clinic with other staff?
I do most everything myself. I do acupuncture, I do manipulation, I do a lot of different types of ultrasound guided injections. I do injections of regenerative products, and those are really have been very helpful for many people. It's not the be all end all. It's not an absolute cure. It's not gonna, keep someone from having to have surgery if you're bone on bone, but it can put that off, and it can actually make someone live a little bit more functional life to not have to have some of these different procedures and big surgeries and everything done. but I work with the patient to tell them, where they're going to need to go. And I have colleagues that will be working with me in physical therapy, orthopedics, and spine activities, and also spinal injections.
So when you mentioned that you use regenerative products, and I think you're talking about injections. Can you talk about what the different regenerative products are?
It's a whole spectrum of regenerative products, such as platelet-rich plasma, which comes from your body. It's your cells. And up until you're around 50, you have a lot of good growth factors in your own body that can actually work really quite well and have those growth factors. As we age past 50, it's kind of a crapshoot. Some people who are very healthy still have very healthy growth factors in their cells. And this is already dropped off and aged off. So that's where you're seeing a lot of these things out in public where people use donor growth factors. They're called stem cells by other companies, but actually by the FDA, that's not really appropriate and considered inappropriate to call them stem cell treatments. And because there's so many different products out there, a lot of these come from a live birth leftover product called amniotic fluid. So after the baby is born, all this fluid that would normally have been thrown away was found to have extremely good growth factors. So they take these growth factors and take out, make sure they don't have significant amount of DNA in them, and they mainly have those growth factors. Some of them do have good progenitor cells, but some of them don't. It's really hard to tell because of the processing if that's in there. So, some of the products have been used improperly and bait and switched. And that's one thing I do for my patients is I'll advocate for them. I will go with them, hold their hand through a process. If it's a good product, I'm not going to say, don't go do it. I'd rather say, it's a good product, go ahead and go with this, but here's what you have to look out for, and don't be overcharged or don't be taken advantage of in the situation. And that's what I like.
So that kind of stem cell treatment you don't do yourself?
I do.
Actually. Oh, you do? Oh, okay.
I have my own product lines that I work with, but if there's somebody out there that needs help in figuring out where they are, they may not be here in Arizona. They may not be able to come to see me, or I've already started seeing someone else. I like to make sure that they're not being taken advantage of.
Yeah, because there's a lot of unscrupulous operators out there, aren't there, in the stem cell field?
There are. And there's a lot of misinformation out there and a lot of confusing things. And it's very easy to get confused by the different companies and how they're doing this assay or that assay or what their product line is. And, the risk of infection from some of these things are quite high. And, or it just may not have much of that growth factor in it. And it might be a product that has, a level of 2 that they're charging for a level of 10. And you want to make sure you're getting what you're paying for and getting the treatments that you want. And, they work. The regenerative cells really work. And the growth factors work very well. It's just being used properly in the right environment and the right products.
I've also heard something about, if the product is not injected in just the right place, then it doesn't do too much good. And that some practitioners are not skilled at placing the product properly.
Right. And that's why it's important to go with someone who's board certified for doing the injections. And they're using guidance, whether it's a fluoroscope or if it's an ultrasound, making sure it does go into the right place. There are certain things, if it goes, in different parts of the body, that it may not make as much of a difference. Like if you're doing a cosmetic procedure and it's really going into the scalp for hair or to the face for some of the cosmetic issues, it's going to get there. Or if it's going into only a part of a muscle, it might get there. But if you have a torn tendon, if you have spinal issues, if you have an actual joint that needs the treatment, it's really very important to get it into the right spot. So there's so many tools of getting into the right spot. Sometimes it's ultrasound, sometimes a fluoroscope. The newest one I just received training on is these little arthroscopes that go into the joint. So you can actually get movies and pictures of those areas where you're treating and putting the injections in.
So when you say it goes into the joint, that sounds like very invasive and painful.
It is a little bit painful. So, most of the time I've been practicing on cadavers, and we do this at a surgical center, and there is a little bit of anesthesia that does need to go with it.
So is that local anesthesia?
It's definitely local. And then from the other colleagues that I have that are doing it, they do have a little bit of like more of a twilight. So you're kind of a little bit fuzzy for
Yeah.
about an hour, and then you get to go home later.
Yeah, it's a calming. They're doing that for calming,
Yep, for
basically.
calming. And then the other thing I also do is for different types of neuropathies, the regenerative treatments work. And there are specific areas where you have to put those, but you don't always need the ultrasound guidance, depending on if it's peripheral neuropathy or a focal neuropathy. If something that's specific that you have to look at, you really need to guide where you're going with your treatments and where your injections, no matter what I inject. I inject a lot of very inexpensive non-regenerative products made out of homeopathics and anesthetics that work quite well. And they're a lot less expensive, but you still need to know where you're putting them.
Yeah. So I haven't heard of homeopathics as regenerative medicine, and maybe you could talk a little bit about that, starting with, because a lot of people don't know what homeopathy is.
Okay. Homeopathy is basically using a type of energy medicine that basically takes the energy of what is causing your problem and turning it around to making it actually curing the problem. That's in its most holistic sense. And so what happens is, for this type of energy medicine, the more dilute it is, the more powerful it is. It doesn't make any sense whatsoever. And it's really hard to wrap yourself around that science, but for some reason it really works. And so they've been using this, for thousands of years in lots of different types of medical treatments and everything. And so actually before the 1900s, that was our mainstay of treatment. Almost everything was based on homeopathy and natural remedies prior to the early 1930s and 1940s.
Before pharmaceutical medicine came in.
Right.
So in homeopathic regenerative medicine, you would be injecting a homeopathic remedy.
Right. There's these standardized sterile solutions. You really don't, so that's the other caveat of homeopathic injections and some of these other strange things out there. You want to make sure someone's using a sterile solution. You don't want to use an acupuncture dipped in something. An acupuncture, there are some people out there that'll dip an acupuncture needle in something, God knows what it is, and then put it in you, and you can have some weird reaction. You can get infections. You want to make sure everything is sterile, make sure everything is, clean and processed properly. So I use a couple of different brands of homeopathic products, and the brands I use a type of homeopathy called Homotoxicology, where it's actually almost like an orchestra of the combination of homeopathics made to match a diagnosis. And that I mix with an anesthetic so that it kind of gives it that boost. Most Americans want that initial boost to saying, hey, I got some pain relief. And it also tells me if I got it in the right place when I do use the anesthetic. So if it tells me what I got in the right place, tells me where it is. And the homeopathics give it that extra boost for a little while. I usually throw a little bit of vitamins in there. So if I just did straight anesthetic, you might get maybe a couple of days off of an injection. When I use the homeopathics, the vitamins, and everything together, you're going to get usually between a few days and a few weeks off of that. And it's really good to avoid using steroids. With a lot of the COVID issues going on right now, people are saying, it was all over the place, whether to avoid using steroids or to use steroids. It's a roller coaster. But it has been proven that using too many steroids causes increased degeneration of the joint. And I do use steroids because that's covered by insurance. And so that might be my first injection on a patient who's got a really hot knee or a hot shoulder, and it really needs to just kind of knock that inflammation out. But then usually if it's a significant amount of arthritis, or if the patient prefers it, I'll use the homeopathic concoction.
So what kind of things would that work for?
Works for just about everything. Anything I'd inject: muscles, nerve, joints, tendons, ligaments, just about everything. You could use it for different types of, there's an advanced level of acupuncture called Biopuncture. And I'm sure you've heard of this before too with what you do. Biopuncture has so many publications out of it, and 3 different ways of calling the exact same thing biopuncture, when it's really all different types of things. So the type of biopuncture I'm referring to is using this solution in acupuncture sites. And that actually tends to give a pretty good result as well.
So, when we're talking about steroid injections, we're talking about knocking out the inflammation so the person is, pain-free, or less pain, but the pain always comes back because the steroid wears off. My experience with homeopathy is you're starting a healing process, you're triggering a healing process. So do you find with those kinds of injections that, people may need more than one, but do they tend to get better?
Yes, actually, you're spot on. That's why I actually consider the homeopathic combination injections regenerative, because steroids are basically you're hitting a fly with a hammer. You're just really knocking something down, so it's very destructive. But it's good for certain things that need to be knocked down. But when you're talking about the different homeopathic products and the different vitamins and the things that you put through it, you're actually making the tissues healthier and making the person healthier. So from there, they can start more of a healing process. So then you can actually throw in, they can tolerate therapy a little bit better. They can tolerate doing other activities better.
So what else do you do in terms of therapies? What I was going to ask you, I had a little brain freeze for a second. What I was going to ask you is when you talk about, you're starting a healing process and whatever, you mentioned light therapy. You're talking about low-level laser therapy?
Yes, I am.
And that, would you use that separately? Would you combine it? And can you explain?
I think it's easy to combine. People who can't have acupuncture, or people who have wounds, light therapy has been proven to help wounds heal. It helps, different levels of nerve pain. If I can catch a neuropathy right in the beginning, I can avoid, long-term nerve damage with light therapy. And a lot of times it'll be combined with acupuncture. But there's many people that cannot tolerate a needle, cannot tolerate acupuncture, where the light therapy will be able to help.
So we're talking about a specific kind of light. So do you want to explain that? People know about the happy light, like if you have seasonal affective disorder, there's that happy light you could get, but that's not what we're talking about here when we say light therapy.
Yeah, so different types of color lights. You can do the fun green lights. I think the green lights are supposed to be very relaxing in your home, and all the other types of colors are working really good. And actually, blue light is being used for sterilization techniques. Everyone's seeing that UVC blue light everywhere now. The cold laser light has a certain wave frequency, and you can when you get different units, that's actually how you measure the depth and the strength of the laser. So there's basically a few different classes of light therapy. The one that you get with a little cat laser that you're the point, the lecture laser pointer, that's considered maybe a class 1 or a 2. The stuff that you can get from these health fairs will be at the most a class 3, and it kind of makes you feel warm. They're just little LED lights, and and you don't need a prescription to do it. The one that I prefer the best is a class 3B. It goes probably about 2 centimeters deep. And it just, some of the lights heat up, but it's a mixture of lights. It's got these really good, deep, heavy ones that light up, and then some LEDs. You get a little bit on the surface, a little bit below that. And those are where I've seen the best results from.
And that's in that's
lights. And then class 4 takes it a little bit higher. And you can, if the person doing it doesn't know what they're doing, you can end up with a little bit of a burn or that kind of thing. And then once you get past class 5, those are the ones they start using for skin treatments, for laser peels, and for surgery and that kind of type of thing. So
those are the cutting lasers.
Right. So staying between the class 3B and 4 is really the really good one for tissue, nerve, and body healing. And it does help on trigger points and muscles and everything too. And your total ability to use these lights is based on the dose. So the ones that you can get over the counter may still work if they're class 3A or class 2A or whatever it is, but you're gonna have to leave it on there for almost forever to get an effect. The class 3Bs and the class 4s, they're short, and how many diodes and how strong it is, you might get a faster response and a faster healing time.
Hmm. Hmm. And we're talking about mostly like red and infrared light, right?
Correct.
Right. Yeah. Yeah, I'm a big fan of that. I use that for myself personally and in my practice too.
Okay, and then I
It's
also like using alpha stims for helping with anxiety, stress, and
mm,
helps with migraines and pain control. And I do a lot of injections for migraines.
what kind of injections do you do for migraines?
Well, the most common ones are the suboccipital blocks and the cervical blocks that
Hmm.
help with the migraines that come from the upper neck. And then also what I can do is there's a spot right here on the side of your temples that you can inject with ultrasound guidance that knocks brain out right, the migraine out right away.
Now, are
Um,
you talking about when you say nerve blocks, you're talking about steroids there?
no, I
Or,
don't like using steroids on those blocks.
okay, so what would you be injecting for those? I'm sorry.
I'm sorry, what I usually do in those places is my typical trigger point solution or my homeopathic anesthetic solution
Oh,
is what go in there.
so what's in your trigger point solution?
It's numbing medication, B12, and a mixture of injectable homeopathics.
Oh, okay. So lidocaine mixed in with that?
Well, it depends on what I can get
Mhm.
because we have different shortages of different anesthetics. So I use lidocaine, I use marcaine. It's my least expensive combination, but then one of them will go on back order and actually ends up being quite expensive. So I'll use Neuropin, which is a very expensive anesthetic, but it's a very effective one.
Mhm.
Does that hits that short acting and long acting right off
Mhm.
the bat. That's Neuropin is actually the best anesthetic to use with any of the regenerative medicine techniques. Although when you're using these amniotic regenerative cell products, we're really not supposed to use any anesthetic at that time with it. And so that's why I use somewhat smaller needles. And my patients, usually like my injections pretty well.
It's hard to imagine someone liking the injections. You mean they get good results and they like the results?
They do. And it's really amazing. It's like you would think that, why am I, all these patients are coming in. It's like, we want injections. We're
Yeah.
coming for injections today. Throw some needles at me.
So, do you find that most of the patients who come to you have already been the conventional route and it didn't work out for them? It didn't help?
I see a little bit of both. I see people that really just don't want to be completely conventional and they like what I have to offer. I have other patients that have, been through Mayo Clinic, they've been through Barrows Neurological, they've been through the Ringer, they've been through everything. And what I love about when they've been through that, it's like I have this whole differential of, 20 or 30 different things. And because
Yeah.
they've been to those other centers, I'm down to 5.
Yeah.
Because I've had very good teachers. And so having all those good teachers makes me say, okay, these are all the possible things we could be dealing with. And then when they've come back and they've already ruled out 15, I've got 5 left, choices left. And then after that, I'm like, well, I don't know. Sometimes I'm like, oh, there's an epiphany because this whole thing, we're all focused on one thing. And then they come in and it was actually something completely different that was causing
Right.
everything to be going through.
Right. Yeah. A lot of times conventional medicine misdiagnoses the problem. For instance, someone will come in with back pain and they'll do an MRI and they'll find a degenerative disc and they'll say, oh, there's your problem. Let's
Right.
go at it with surgery. But that's not the problem. Most people have disc disease, especially as they get older, but most of them have no pain. And that could just be a coincidental finding that there's that disc, and it could actually be muscle or tendon or a nutritional thing or too much stress or many things that can cause pain, and but they get targeted for surgery and then they're worse because
Exactly.
that's the right problem.
And there
So
are people where they need surgery, but surgery is a last resort. And, exactly case in point, I think when I was in training, we had this woman who was a beautiful woman. She was a tennis player in her 80s. And she came in having some problems with wrist pain and arm pain. And we looked at her MRI of her cervical spine. Everyone was so focused with how horrible her cervical spine MRI looked. And when we got down to looking at her, it really was the fact that she had such bad arthritis in her wrist. And that was really the problem. Had nothing to do with how horrible her neck was. She had already accommodated to how her neck was, how she's aging and how she's changing.
Right.
So there was no reason to go after her neck. And
Right.
somebody else had already put injections and this and told her she needed surgery, but then nobody had done an EMG or nerve testing on her. Nobody had really done an exam of where she was complaining about the pain.
Yeah. Yeah, I read a story once that was pretty terrible about, and was in, I think, the Boston Globe, of a woman who had pain in her thumb. And it was very, very, very severe. And she went to all these different doctors and they did MRIs and they decided that it was a problem with a cervical disc. So they did surgery and she was no better. And then they decided they may as well go after some other cervical discs. No better. You know, third surgery on a cervical disc and no better. And she finally went to a doctor who specialized in hand surgery or something. And he found out that there was this tiny little growth under her thumbnail that was causing the problem. So she went through 3 orthopedic surgeries on her spine, and it had nothing to do with that. The problem, the pain was in her thumb, and the problem was in her thumb. You know,
I've heard the same story told the same way, except it was a brain tumor.
Yeah.
Okay, so it's important to know how to do an exam, how to test for where the problem is.
Right. And, you know, if you just have one tool in your toolkit, which is surgery, you know, you go to a surgeon, they do surgery. So they're going to be looking for something that could be addressed through surgery. And when they see something that, you know, could potentially be, there's your problem. And that's, you know, I only have a hammer, you have a nail, you know. So it's great to, you know, to go to a physician like yourself who has broad experience, broad knowledge, lots of tools. And then in addition to that, none of them are potentially dangerous.
Correct.
They're not going to, none of the things that you do are going to leave people worse off.
Correct. Yeah, and you know, part of the osteopathic principle is to have someone leave your office feeling better than the way they came in. Even if they can't do something that day for someone, if I can tell them a joke and let them smile, that might even be a good thing.
Yeah, that helps a little bit.
You know, still, you know, that's the hard part is we can't hug our patients right now during COVID, is, you know, just or you know, just that hands-on approach is difficult with, you know, with everything right now.
So can you talk about another patient or two, you know, maybe who's been through the ringer and then, you know, came in and.
Well, one time, you know, I can have patients come in, you know, let's say I have 3 patients come in one day with shoulder complaints. Each one of them would have a different reason. One could be a cervical disc. One could be a rotator cuff tear. One could be, you know, a different nerve injury that you can get when you bench press with poor form. So it could be all different reasons.
Right.
I would say
chronic stress.
Or chronic
where
stress.
You're walking around like this.
Exactly.
Or this. I used to be one who did this and I had pain on one side. I wonder why.
Exactly. You don't realize it until you see yourself or anyone else sees you. And my best story that I used to tell is that one of my favorite patients who ended up graduating from my practice, he had such horrible post-surgical pain and had a lot of metabolic disorders and everything. And years before I saw him, he had told that he told his pain doctor that he's a New Yorker, so he's very emotive, very descriptive, and just a fun gentleman. And he actually came in with the best jokes all the time. And, he told his Arizona doctor that he felt like he had an animal attached to his leg. And
biting his leg.
And so he was taken literally by this doctor that he thought that this patient was hallucinating and saying this animal was biting his leg.
Oh, geez.
And so he was hospitalized in a psych ward for 3 days.
Oh, geez.
And comes out, and then we started, eventually he found his way to me and we were working with him. And he ended up graduating off of his opiates. He ended up graduating into being much more functional. and doing really well.
And what did you do with him?
It had to do
How
with
did you
all
help
the,
him?
it had to do with nutritional approach. It had to do with his medication approach, physical therapy, and also his mindset. So all of those things put together, we really made a huge difference.
And what was it that was causing him to feel like an animal was biting his leg? You might be seeing cat ears in here because the cat just came on my lap. I'll just show her pretty face for a second.
Oh, she's so beautiful.
She likes to come over when I'm Zooming.
Oh, okay.
So anyway, what was it that
He had so much scar
causing-
tissue wrapped around his nerves that had really caused a lot of problems. So we did, one of the things I do in my practice, I guess I didn't touch on it, is I do scar deactivation. So I'll inject around the scars, loosen up the scars, attachments on tissues and things like that, make it seem a little bit more free. And that really made a huge difference.
Uh-huh. Yeah, I can see that's a cattail. I can see how that can feel like an animal attaching itself to your leg, because you're being, something is gripping you,
Right.
Yeah. Yeah. So anything else you'd like to add about integrative pain management or your practice that you'd like people to know?
I just like to say integrative pain management is truly integrative. You can use, integrative approaches as well as traditional approaches, and one doesn't have to be exclusive of another. And I really do enjoy teaching, so I'm looking forward to teaching with my new practices.
Well, that sounds great. So tell people where they can find you. How can they
You
get?
can find me at www.az-pmr.com, and our phone number is 480-955-1515.
Great. And if you can't remember that or you didn't write that down, then you don't want to rewind. You can also find Dr. Farrell on the Alternative Pain Treatment Directory, which is paintreatmentdirectory.com. And if you're not in Dr. Farrell's area, you can find other providers on the Pain Management Directory. So thank you for joining us, and thank you, Dr. Farrell. So nice to talk to you. You take care. Have a great time. Have a great night.
Thank you. You too.
Bye.